I'm a clinical psychologist and mindfulness teacher, and I'm here today to talk a little bit about some online mindfulness courses we've been delivering during the COVID-19 pandemics with older adults, and that works in collaboration with Annabelle Stickland and Nuri Capelli. So first of all, how has the lockdown affected older adults? Well, we know that loneliness and isolation can affect older adults by increasing depression, anxiety, and cognitive decline. It reduces resilience factors such as self-worth, sense of purpose, and feeling valued. And it also has physical effects as well. So it has a negative impact on blood pressure, sleep, immune stress response, and cognition. So how might mindfulness help with some of these effects of the COVID-19 pandemic on older adults, isolation and mental health? Well, mental health is, mindfulness is quite interesting really. It helps with both physical and mental health difficulties. So it can improve heart and circulatory health. At a brain health level, it can reduce some of the thinning of certain areas of the brain that naturally occurs with aging. And for mental health as well, it's at least as good as medication or counselling for the treatment of clinical level depression. So in terms of what we offered, it was 6 weekly sessions, and they were 2 hours long, delivered during the 3 COVID-19 national lockdowns, so between 2020 and 21, and they were all held online via Zoom. They were based on the MBSR, the Mindfulness-Based Stress Reduction Programme developed by Jon Kabat-Zinn. And in keeping with that programme, participants were given links to a series of home practices, handouts, with home practice typically lasting 20 to 30 minutes a day. Now the interesting thing for us was not simply what happened to participants' anxiety and depression levels, which really positively declined for many participants, but how older adults experienced the online course. So what we did was we ran focus groups for participants from the course, and this was 36 participants aged between 65 and 85. This is what they told us, that many of the reasons for them applying were linked to COVID-19. So, for example, I just needed something to slow me down and get me anchored in the present. Some people specifically talked about the loneliness they were feeling. So they wanted something that could stop the loneliness. And for other people, it was about that shift from going from a very busy life to nothing, or to a lack of social interaction. In terms of how people experience the mindfulness therapy, they told us that, it really helped them to calm down, helped them to relax, and it helped them to kind of cope with not being able to see family and friends. In terms of the video conferencing itself, we were quite surprised that participants actually really liked the video conferencing. And a lot of people told us that they preferred that to being in a face-to-face group, especially people who were in quite a rural setting and found it quite a long drive to connect with people. They really liked the online environment. And so we're hoping to continue to carry on delivering the courses. And if you have any questions about that, do feel free to contact us via the Gatehouse website. Similarly, if you have any interest in learning about mindfulness a little bit further, do access the BAMBA, British Association of Mindfulness Based Approaches, which gives you a list of accredited practitioners.